Hi, I'm Dr. Kelly Harding of Columbia University Medical Center, and this is one of a series of segments, actually the second segment, on hypochondriasis. And I'm joined here today with Dr. Arthur Barsky of Harvard Medical School and Dr. Brian Fallon of Columbia's College of Physicians and Surgeons. In this segment, we're going to be talking about what are some of the beliefs of people with hypochondriasis. So just to start, what are some of the beliefs of people that have hypochondriasis?
Well, it's interesting. They have a number of really misunderstandings about illness and the medical care process and disease that really bedevil them. And things like, for example, many people, not just hypochondriacal people, but many of them believe that if you don't have, it's impossible for the doctor to rule something out unless he or she does a diagnostic test. So if the physician just does a history and a physical exam and says there's nothing serious wrong with you, they say that's not possible. He couldn't possibly know that. He didn't order any lab tests.
Mm.
Often people believe that if they're not having the symptom when the lab test is performed, then the test is invalid.
Okay.
So they'll say, well, I had my electrocardiogram, but I wasn't having the pain when they took the electrocardiogram. Therefore, it's not a valid test. And there are all sorts of ideas like that. A test will come back and the physician will say that it's normal. And then the hypochondriacal person will worry that, well, it was maybe the blood sample got mixed up with somebody else's sample. It was mislabeled, or maybe the
Okay.
laboratory made a mistake, or it wasn't the most recent way, most effective way of doing the test. Once you're anxious about something, if you get information that doesn't fit with your beliefs to start with, you just dismiss it, and that tends to be what happens. They'll figure some reason for the explaining away why the test was normal.
There's also the thought that they believe that every symptom they have should have a medical explanation. So if you have a pain in your knee, that should have a medical explanation. If you have head twinge, like a little fasciculation, a movement of the skin in your head, that should have a medical explanation. So even though it's not profoundly distressing itself, or even though it doesn't really point to any specific disease, they want to know the answer. So they go to the doctor, and the doctor is dealing with people who have diabetes or multiple sclerosis or congestive heart failure. And then you come into the office and you say, I have a little twinge in my head. What is it? Well, you can imagine how the doctor is going to respond. The doctor is going to say, why are you bothering me? And why are you coming into my office with this minor complaint? And yet the hypochondriac is actually quite distressed, but they also have enough insight to know that this is a kind of a minor thing. So they might sort of laugh it off and say, I have this little twinge. You think it's serious, doc? And the doctor will say, no, it's not serious. Don't worry about it. And the hypochondriac will say, yes. But then they'll go home and they'll think, oh my God, I really didn't tell him that sometimes I have this twinge and then it goes into my ear and then I start feeling head pain. And maybe, I looked on the internet and I saw that it's could be a sign of brain tumor. And then I asked, on one of those blog sites, what should I do? And, they said, go contact a neurosurgeon and be evaluated. You need an MRI scan. And, then I'm filled with dread.
It seems like a terrible position to be in, though, both as a patient and a physician, just because it sounds like it's really something that's on their mind and it's something that they're worried is connected to a
No,
much more
it's
serious
terrible. I
disease.
think it's, when I
Uh,
tell them, when I talk to the medical students about this, I say, imagine, this is the way I start my lectures. I say, imagine that, no, I actually say, what I do is, I start off my hypochondria lecture and I say, before I start my lecture, I want you to listen to something I just heard from the security guard. The security guard just told me that there's a serial killer out there on the loose who just killed a medical student at a neighboring medical school, Einstein, and he's on the way to Columbia University. It's the fear that the police believe. So the security personnel here ask me to alert you to be careful when you leave the building and to make sure that you don't spend too much time outdoors. And when I say that to the medical students, all of a sudden there's panic in their faces and they're mumbling to one another. They look profoundly distressed. I feel a little bit guilty because I know it's not true. But what I tell them is, now try to capture the feeling of fear and terror that you have now. Imagine what it's going to be like for you going outside, looking to see where is the assassin behind the car or behind the corner, and where is the danger lurking, and you don't know. So you're looking everywhere. Even benign things, people you think are safe might not be safe. if you can capture that fear, that's what the fear is for the hypochondriac, except they see the assassin as a disease inside their body. So they're living daily with that horrible terror, and they feel a profound obligation that they need to monitor every single symptom because that could be the one.
Yeah, I think another point you made initially, Brian, is really important, and that is to understand a little bit about what goes wrong in the doctor-patient relationship, what goes wrong in the medical care process with these sorts of problems. Because as Brian said, most physicians are basically trained to find the quote, the real disease, to find serious disease. And if you don't have something serious wrong with you, then from the doctor's point of view, it's not, I don't need to see you. You don't need to be in my practice. You're not sick, quote, unquote. And that makes for terrible trouble because the patients feel they are indeed sick.
Right.
And so the doctor ends up trying to sort of dismiss them, saying, this is trivial, this isn't important, this is not what I'm trained to do. And it's absolutely contrary to the hypochondriacal patient's experience, which is I absolutely am, something's wrong. I mean, they're definitely suffering. And it leads to this really unproductive, unsatisfactory relationship between doctor and patient. I mean, hypochondriacal people find doctors to be dismissive and disparaging and disrespectful, and it only makes the problem worse.
It's true. It does seem like a vicious cycle in some ways. And then it also seems as people sort of get castigated as one group that maybe, in fact, something does get missed sometimes.
That's right. That's true. I mean, I have had hypochondriacs who had been dismissed by their physicians who actually did have something serious. So just because you're a hypochondriac doesn't mean you don't get sick.
Right.
But it's so hard for the physician because if you know the patient well, you know the person's a hypochondriac. So when the person comes in complaining about a symptom, you really, as a physician, need to keep a fresh, open mind that maybe this is something.